everyone, my name is Ellen, and today I'll discuss the effect of socioeconomic status on the rates of breast cancer and its implications on global health. As for a quick introduction, I'm a rising senior at Poolsville High School's magnet program located in Maryland. I'm a nationally ranked debater. I was ranked third in the US last year. I'm also the captain of my school's HOSA club and also participate in Science Olympiad, where I was ranked 10th at the International Biology Bowl. And I'm currently a student intern at the Food Drug Administration, where I research hormone therapies in breast cancer patients. And I presented my findings at the Oncology Center of Excellence. So I'm super excited to share my research and interest in oncology with you all today. So I hope you enjoy. As for a quick agenda, I'm going to start by introducing breast cancer, then discuss income and its effects on breast cancer diagnosis, then go on to talk about the pricing of treatment options, and finally conclude my presentation. So an introduction. What is breast cancer? Breast cancer is caused when breast cancer cells grow out of control or abnormally, which can lead to the damaging of normal tissues and ultimately the formation of tumors. The most probable cause of breast cancer is due to changes in the DNA or the genetic material in cells, often caused by mutations. There are a lot of risk factors associated with breast cancer, which include aging, family and reproductive history, being overweight, and other lifestyle factors like smoking, being physically inactive, and excessive alcohol consumption. So it's super important that we stay active and healthy to reduce these risk factors. To put the numbers into perspective, each year in the United States, there's around 264,000 cases of breast cancer in women and about 2,400 in men. And about 42,000 women and 500 men unfortunately die from breast cancer yearly. If we look to the graph on the right, we can see that the annual number of new cancers has been on the rise since 1999 to 2020. So as the prevalence of breast cancer has been increasing, it's super important that we take the precautionary measures necessary to curb the crisis. So breast cancer has a lot of implications on global health. There's an economic impact, as breast cancer mortality results in a loss of productivity, which not only affects patients, but their families, caregivers, and economies as a whole. There's also a psychological aspect, as a breast cancer diagnosis can lead to significant psychological distress for patients and their loved ones, and also social impact, as the mortality rate of breast cancer is a lot higher in low and middle income countries due to late-stage diagnosis and limited access to treatment. Now I'll discuss income. So individuals of higher income often have increased quality of life and access to more resources, as individuals from higher socioeconomic status are able to afford and access quality healthcare services, which are super important in the early diagnosis and treatment of breast cancer. But beyond access to treatment, epigenetics also plays a role. Epigenetics is basically when your environment can result in changes in your DNA. And individuals of lower socioeconomic status are often exposed to poor environmental conditions, like airborne toxic metals and toxic fumes, which can lead specific changes in their epigenome and result in dense breasts. Also, women in disadvantaged neighborhoods tend to have poor dietary behaviors, such as a low intake in folate and high-fat diets, and these extra fat cells can make estrogen, which can cause extra breast cell growth and only increase the risk of breast cancer. Also, lower socioeconomic status women were less likely to receive sentinel lymph node biopsy, radiation, auxiliary surgery, and adjuvant chemotherapy, and were more likely to rely exclusively on tamoxifen, a hormone therapy, and less likely to use the more expensive but more effective aromatase inhibitors, also known as AI. So now I'll discuss the pricing of treatment options. A study in the Canadian Breast Cancer Network found that 80% of breast cancer patients received a 10% drop in their income due to breast cancer treatment, and 1/3 of patients believed their financial struggles from breast cancer would have a long-term negative effect on their health. That is because the cost of breast cancer can range from around $20,000 to $100,000, a huge financial burden for many. In fact, in 2018, the World Health Organization found that in high-income countries, the number of cases was 78.3 incidents and 12.9 mortality, But in low-income countries, the number of cases was 36.5 incidents and 12.8 mortality. So what do these numbers mean? This means that in high-income countries, there is a higher prevalence or incidence of breast cancer. That's often because higher-income countries have access to better screening technology that can actually detect and diagnose the breast cancer early on. But in many low-income areas, a lot of breast cancer patients go undiagnosed, which can be very life-threatening. Additionally, even though higher-income countries have more prevalence of breast cancer, the mortality rate between the two countries is often really similar. That's because lower income countries don't actually have access to this life-saving technology to treat breast cancer correctly. So conclusion. There are a lot of current programs that exist right now that can ease the inequities that exist in the healthcare system. Some examples include the Cancer Financial Assistance Coalition, also known as the CFAC, which is a group of national organizations that provide financial help to breast cancer patients. There's also Medicare and Medicaid programs and social safety nets to help low-income individuals. And also there's the Komen Financial Assistance Program to eligible individuals undergoing breast cancer treatment at any stage. So these are just a few of the current programs that exist right now that can help ease the inequities that currently exist in the status quo. Overall, the effect of socioeconomic status and the rates of breast cancer is highly correlated. Disparities in breast cancer are the result of multivariable influences and many factors, such as biological, behavioral, socio-demographic, and environmental aspects. And it's super important that we provide government subsidiary or support to lower socioeconomic class to get free or low-cost mammograms that can help reduce the disparity in the incidence and mortality of breast cancer worldwide. So here are my sources. And I would like to acknowledge the Global Health Leaders Conference for hosting such an amazing program. My past research mentors at the FDA, specifically Dr. Benjamin Chukwari, Dr. Kanisha Salvari, and Dr. Santidros Choudhury for aiding me in my research journey so far, and the GHLC students and staff for listening to my presentation. So thank you so much. And if you have any questions or any feedback, I'm always open to suggestions, and my contact information is found here. Thank you.